The coronavirus pandemic made routine visits to any doctor's office challenging. Many healthcare professionals turned to telehealth or telemedicine to check in with their patients. Telemedicine and telehealth have been around for several years, but patients barely knocked on the virtual door. That all changed when social distancing orders came into play. Doctors began to see an increase in virtual appointments, and this gave Dr. Stephen Lloyd the idea to offer the same virtual services to his patients who were struggling with addiction.
We had been thinking about telemedicine for a long time. You're looking at limiting face-to-face interaction so that we don't spread the virus. So it obviously makes sense from that standpoint. And so I have patients a lot from rural areas that were spending a lot of money to come to see me. And so now you take this at-risk, vulnerable population, and now you have a way to get them access to treatment without, sometimes $20, $30 worth of gas money each way, which is a limiting factor. Folks don't have driver's licenses, or if they do, they are worried about, being caught with medication that's used to treat OUD. And so, those were barriers that we've known for some time. But the hard part of it is that human connection. Although we can still do a pretty good job here, I'm talking therapy sessions. I'm a big fan of group therapy. There's great value in that. So that becomes a little bit more of a challenge.
Can you do group therapy through telemedicine? Like
you
Zoom
actually
call?
can. Yeah, we can. And we're getting better at it.
So you talked a lot about the pros, but what about the cons to telemedicine?
There's some urine drug screening stuff that obviously I can't do over the computer, but I've never used urine drug screening, Tamika, as a punishment or a gotcha. It's another tool to help me make clinical decisions, and so that is a bit of a challenge. But really that connection piece.
That piece of connection with his patients is what Dr. Lloyd values most. He knows firsthand what it feels like to struggle with addiction. You see, 16 years ago, Dr. Lloyd started his own recovery from opioid addiction.
I thought my life was over. I got addicted to pain medications, OxyContin, oxycodone, as well as benzodiazepines, Valium, Xanax.
Within 3 years, I was using the equivalent of 100 Vicodin a day.
Wow.
So not 100 milligrams, but 105 milligram pills.
Yeah.
So it's 500 milligrams of OxyContin a day. I used to go to bed half the nights praying that I wouldn't die in my sleep because I knew how much I was taking every day. And the other half praying that I would die in my sleep because I didn't see a way out.
Did you ever hit rock bottom?
People saw changes in me and wondered what was going on and wrote it off to me being overworked. Everybody except for my dad. And my dad actually figured out what was happening and confronted me about it, and my life changed. So, yeah, that's a bottom. If you go to bed at night not knowing if you want to live or die, I don't want to do that again. And when my patients come to me in that desperation, I know what that's like.
And because he knows what addiction is really like, Dr. Lloyd says the first step for anyone fighting any type of addiction is to ask for help.
I don't care how dark it is. Ask for help. You think about what could have happened and then what didn't happen. And I think too many times our message is, well, we're going to give you this chance, and this is your last chance. I want people to understand that there are folks out there who will meet you where you are no matter what. And I don't care how many times it takes. Mine took one. Great support, great people around me. It's no less of a success story if it took 100.